Hello, Brown Nation. Welcome to another episode. Today I'm doing a Q&A and I'm going to answer questions such as how to plan your comp cycle, how effective is Masteron at what body fat percent, and questions like, well, which is a better compound to pair with testosterone, whether it's Masteron, Primo, or something else. So stay tuned. A really good Q&A first. First of all, as always, let's go to the disclaimer. Okay, firstly, thanks to everybody who sent through questions on my Instagram. For anybody else who's watching and has any questions on PED, on training, any of it, reach out to me. kg.physique is my Instagram handle. Send me a DM, and I'll answer your questions in this Q&A that I'll do probably every week, depending on how many questions I get. But I've got some really good questions today, so we'll go through those questions and I'll run through any explanations as well. Okay, first one is from Rahul from Ludhiana. KG, if I can afford only one compound apart from testosterone, would you choose Masteron or Primo? So the thing you have to worry about is Primo at the moment. There is a shortage of Primo. It's also more expensive than Masteron. Also depends on what your goals are. So Primo is generally used when you want to bulk up. It's in a bulking cycle. Masteron is used to cut. Masteron, and I've got a video on both of these, but Masteron is important when it dries you out. So when you're trying to bulk or put on muscle, as you increase your food and increase the weights, Masteron might cause issues for your joints since it dries you out. Both sort of affect estrogen, and they're good sort of precursors to the aromatization that happens with testosterone when you increase your testosterone dose. But it depends on what your goals are. So if you're in a cutting phase, then I'd say pick Masteron. If you're in a bulking phase, I'll pick Primo. You can also do both. You can even do, say, in terms of ratio, 1-to-1 ratio of test Primo Masteron. So something like 300 test, 150 Master, 150 Primo, depending on your estradiol levels. So both are good. Really just depends what your goals are. Primobolan is known to cause quite a bit of a PIP. So PIP matlab injection ke baad thoda pain hota hai, that sometimes just cause inflammation. So you have to watch out for your HSCRP, your high sensitivity reactive protein. You don't want your body to be constantly inflamed. It's really bad for your heart. So Primo depends. Some people can't tolerate it. Some people can. I struggle with Primo. I tend to get quite a bit of inflammation. So see how you go with it, but depends on your goals. Both are equally good. Masteron has not been tested for its anabolism. Primo has been, but testosterone is your anabolic, more anabolic than Masteron and Primo. So they're both good. You can give one a shot and then give another one a shot after sort of 12 weeks. But if you're cutting, Masteron, bulking, Primo, or sometimes go half and half for both with testosterone. All right, next one is from Arjun from Karnal in Haryana. At what body fat percent does Masteron actually start making a difference? Is it worth using if I'm 15% body fat? You can start at 15%. I've certainly started at that. So you can go on test and mast at 15%. Your testosterone cycle will probably be 2-to-1 ratio to Masteron. And then you can sort of make them equal as you start to lose body fat. Key thing is your diet. I mean, if you want to cut, you need to get your diet in line. So if you are on test and mast, I strongly suggest you watch your diet really, really carefully. Make sure you're eating enough protein. Your carbs obviously depend on what your activity is like and how much you're cutting. And then fats will be for your hormones. So make sure you eat clean. But yeah, 15% is not bad. You can definitely start on 15. It will start to make a difference when you're sort of at that 11-12% and lower. That's when you'll start to get more vascular and start to dry out and start to look really impressive. All right, how do you personally control estrogen during a cycle? Do you rely more on AIs or compounds like Masteron? This is from Rohit from Amritsar. No. Estrogen is really controlled by your diet. So you really need to watch your diet, make sure your diet is in line. Reduce your alcohol, make sure you do your fasted cardio, eat your meat, Your estrogen will be controlled, and it depends on your how much testosterone and whether you're a high aromatase converter or not. If it does go too high, I would then, I'd probably use Masteron. Again, depends on whether you're cutting and bulking. I might go Primo, I might go EQ if you're bulking, or then I might go Masteron if you're cutting. It all depends on that. Key thing for you is to control estrogen first, diet. Diet is really important. Reduce your alcohol or limit your alcohol, limit smoking weed and all those kind of things. Eat healthy, eat your veggies. You can take DIM as well. Do that, and then worry about the compounds afterwards. If you're a high aromatizer, then yes, you might have to introduce Masteron or Primo or EQ, any of them. But you don't want to lower your estrogen too low either, because it does improve your IGF-1 production. So you don't want to very low range of estrogen. And if it's very low, you dry out, and that's another issue. You'll have joint pain and things like that. All right, next one for Vikram. Vikram, as Indian men, we're prone to hair loss. What compounds do you think are the harshest, and how do you manage it? So, few reasons why hair loss is an issue for us. One is there's oxidative stress. So when you take steroids, it does cause oxidative stress to your body, which does cause hair loss and acne as well. It's also environmental factors, genetic factors. There's a number of things that contribute to hair loss. It's, the compounds that are harder, I mean, most of them are not very good. So you've got your testosterone, Masteron, Primo, Anavar. They're not good for your hair, not hair safe at all. There are people who go on nandrolone-only cycles to not get the hair loss, but nandrolone-only cycles, as you know, they're 19 Nors, not good for your brain. A lot of bodybuilders who've been on nandrolone-only cycles are a bit, you know what I mean. Trenbolone's another one, which is a 19 Nor. So you don't want to do that. You don't want to be on a nandrolone-only cycle. So hair loss, depends on what you're losing your hair for. You can look at alternative treatments. There's RU58841. There's could be a lack of vitamin B6, B12, iron, zinc, copper. You can dermarol, GHKCU. There's dutasteride, finasteride, minoxidil. Those are your three sort of medications. But then if they go systemic, they cause problems. So you got to take your pick, or then you do a hair transplant if you can afford it. Or you wear a hairpiece like some of our Bollywood actors do. So all that depends. But I mean, the compounds that you will be sort of taking, your testosterone, Masteron, Primo, EQ, they are going to cause a bit of hair loss. And then if you're more prone to it, you lose it faster. Some people keep the hair. I have my hair, as you can see. I'm on Masteron, Primo, all of it. Made of alto hair, but depends on each person. So think about, reduce your stress. I mean, look at the environmental factors, look at the stress you're in first, then go to over-the-counter, like a sort of prescription medication, which there are quite a few side effects for. So I don't know. I wouldn't be comfortable recommending dutasteride, finasteride, or minoxidil unless you do a very small amount topically to stop that DHT conversion in your scalp. But they can go systemic, so you have to do very, very low amounts, because if it does go systemic, it does cause problems with libido and other things that happen. I mean, you can just Google side effects of finasteride. Causes dopamine issues, all sorts of stuff. So be careful with that. Okay, Farhan, if someone wants to compete in men's physique, what would your first contest prep cycle look like compared to what an advanced competitor would run? First cycle always would be, so I'm assuming that you haven't done a cycle and you're just going into a cut straight. So first cycle always is test. Now I do have a video on how to design your first cycle and what blood work should be done. So give that a watch. But the first cycle really would be, your base would be testosterone. And if you're cutting, you then use Masteron. And then towards the end, you'd add an oral, like for the last 4 or 5 weeks, like an Anavar or Winstrol. And over the last 5 or 6 weeks, if you can handle it, you'd add low dose Tren as well. Compared to an advanced competitor, would probably go testosterone, Masteron, Primo. Oh, sorry, GH. I forgot GH. GH as well, which you would take up 2 weeks before you get on stage. But GH, an advanced competitor would go testosterone, Masteron, Primo maybe. tren, slightly higher dose of tren if they can handle it, and then go into Anavar or Minstrel in your last couple of weeks to dry you out. It's not too different, an advanced lifter versus someone competing for the first time. But if you're competing for the first time and it is your first cycle, you'll have to be conservative in your approach. You don't want to go ham too quickly. आप लोगों को पता नहीं होता है कि side effects क्या होता है, because we are all so very different. जो side effects आपको होता है may not happen to me, जो side effects मुझे होता है may not happen to you. So जैसे मैंने पहले कहा था with Primobolan, I got a lot of pip and my HSCRP was up to 16, which is really high. And these were over 2 blood tests of 20 weeks, 2 10-week cycle blood test timelines in between my 2 blood tests. So 20 weeks my HSCRP was up, which is not good. So Primo is something that's kind of off limits for me, which is not bad. It's expensive and it's hard to find legit Primo nowadays anyway. So yeah, side effects you don't know. So as a first-time competitor, if you've never done a cycle and you're doing it for the first time for prep, you start small, and then as an advanced lifter, they sort of have an idea how much to run. So they'd be a lot more qualified, and they might, if you've done a maximum of say 500 Masteron in one prep, you might go up to 750 if you can tolerate it. Things like that. You will learn as you go. All right. Thanks, Farhan from Kozhikode, Kerala. All right, next one, Tenzin from Ladakh. If you were starting bodybuilding again at 20 years old, knowing everything you know today, what would you do differently? So with gear, okay, so with gear, I mean, one of the things for me was I started gear very late when I was 42 years old. So if I was 20 and I knew things about gear and they were available now, so readily available now, like they were not when I was 20, which was 26 years ago. I probably would have started gear earlier, but I would need the information. So in some ways, it's good that I didn't start gear that early at 20 because the knowledge wasn't there and I would have done stupid things. So at least now I'm a lot more educated on it and there's a lot more information and a lot of educators that go out and tell people what to do. And as long as you follow the right people, you have good advice. So I wouldn't do anything differently as such. I didn't take gear when I was 20. I would be hesitant to take gear at 20. All I would know is to manage my expectations, because when I was 20, I used to look at these massive IFBB bodybuilders and they never used to talk about steroid use. So I used to think that what they achieved was achieved naturally just through eating protein and training, which sounds ridiculous, but I didn't know that back then. So I think that's the only difference, that I would temper my expectations and know that I'm not going to look like that. And even if I take steroids, I mean, they have phenomenal genetics, so that's a different thing. But I wouldn't, I temper my expectations. I was definitely happy with the way I looked, but I wouldn't be looking at an IFBB bodybuilder thinking, oh, I want to look like that without the steroids and the genetics, obviously. So that's the only thing differently. But again, if you're 20, I don't suggest, unless you've got some phenomenal genetics and you can make it in the IFBB to be a bodybuilder. Would I recommend someone at 20 doing gear? Nah. Not really. I suggest you wait till you pass your natural prime, which is about 26, 27, and then maybe start. And that too depends if you're competing. All right. And last one from Prithvi in Mysuru. If you had to build the most effective contest prep stack using only test mass primo and growth hormone, how would you structure it 16 weeks out until show day? So testosterone would be your primary driver 16 weeks out. And then you'd use Masteron Primo. Growth hormone would stay the same at about 4 or 5 IU. Again, dose person dependent and budget dependent. So testosterone, Masteron Primo. And then your Masteron and Primo will start to go to a 1-to-1 ratio with testosterone. As you get to sort of that, I'd say you're starting in about 16 weeks. So probably up until 8 to 6 weeks, it would be 1-to-1. And then sort of 8 weeks out, Mass and Primo would go up to a 2-to-1 ratio to testosterone. And then maybe 3-to-1 in your last 4 weeks. So basically what happens is as you get closer to competition, your testosterone goes down, your Mass and Primo goes up. Now, which one you increase, Mass and Primo? They could go 1-on-1 is fine. You could even drop the Primo and just keep Masteron in your last sort of 4 weeks. That's fine as well. Growth hormone would stay the same, 4 or 5 IU, again, what your budget is, all the way throughout till about, I'd say, 2 weeks before you step on stage. You take the growth hormone out because it does cause water retention. And you will see a dramatic drop once you stop the growth hormone, a dramatic drop in water reduction, water in your body, water retention, and a weight, and you will dry out like crazy. So very, very quickly, within a couple of days, the water will be out of your system, and then you will be back and you will look really dry and really lean. But the growth hormone is really, really important as long as you can afford it. You don't have to take 5 IU, you can take 2 IU, 3 IU, but as long as you can afford it, for muscle fullness and for recovery, and it also helps with fat loss. So GH is pretty important in that sense. All right, hope that helped. Thank you for all of you who've asked questions. I'll do this again next week, but please do like and comment this video if it is beneficial. Subscribe as well. It does help me out and help the algorithms if you do like and share this video. Reach out to me on kg.physique on Instagram. Send me your questions. I'll do another one next week. As always, this is a free channel, free information given out to you. I can send out or list out research information as well, so you know I'm not just making things up. But in the meantime, thank you as always for watching, and until next time, stay strong, stay brown.